In this 5-minute overview, we delve into a recent systematic evaluation of whether prenatal exposure to acetaminophen, one of the most widely used medicines during pregnancy, relates to neurodevelopmental outcomes in children. The review, titled Evaluation of the Evidence on Acetaminophen Use and Neurodevelopmental Disorders Using the Navigation Guide Methodology, was led by Baccarelli et al. At the Harvard T.H. Chan School of Public Health in Boston. The context is straightforward but important. More than half of pregnant women worldwide use acetaminophen for pain and fever, and over the past decade, a growing body of research has asked whether such use might be linked with higher rates of neurodevelopmental disorders, NDs, including ADHD or autism spectrum disorder, in offspring. To address this question with as much rigor and transparency as possible, the authors applied the Navigation Guide, an evidence assessment framework designed to bring systematic methods, pre-specified criteria, and formal risk of bias judgments into environmental health questions, often dominated by heterogeneous observational studies. They conducted a comprehensive PubMed search through late February 2025, screened candidates using a PICO-style approach focused on human observational evidence, and rated studies across multiple bias domains, including selection and recruitment, exposure and outcome assessment, blinding, missing data, and selective reporting. Because measures of exposure, from self-report to biomarkers, and outcomes, from clinical diagnoses to symptom scales, varied widely, and because covariate sets and analytic choices were diverse, the team synthesized results qualitatively rather than force a pooled meta-analytic estimate that might be distorted by apples to oranges comparison. Among these, 27 reported positive associations between prenatal acetaminophen exposure and neurodevelopmental outcomes. 9 reported null findings, and 4 suggested negative association. A salient pattern emerging from their risk of bias and strength of evidence appraisal was that higher quality studies were more likely to report positive associations with ADHD, ASD, or related symptom dimensions. The authors carefully considered confounding by indication, for example, maternal fever, illness, or pain as reasons to take the medication, and the challenges of exposure misclassification, especially when relying on retrospective self-report. They discussed why an overall meta-analysis could be misleading in this landscape and instead pursued a structured, transparent narrative synthesis, triangulating across different designs and sensitivity analyses to probe the robustness of signal. The central interpretation is measured yet clear. The totality of evidence, as organized under the Navigation Guide, is consistent with an association between prenatal acetaminophen exposure and increased incidence of neurodevelopmental outcomes in children. Translating that interpretation into practice does not mean alarmist prohibition. Rather, the authors emphasize prudent, judicious use. If acetaminophen is needed during pregnancy, favor the lowest effective dose for the shortest necessary duration, and make those decisions in consultation with a clinician who can weigh benefits. This stance challenges the older blanket perception of safety and argues for informed, individualized counseling. The review also highlights limitations that future research should address. Residual confounding can persist even in careful analyses exposure metrics and timing windows need better standardization, and outcome measures should be harmonized to reduce heterogeneity and improve comparability. The authors note issues like potential recall bias and self-reported exposure, the difficulty of cleanly separating drug effects from the underlying conditions prompting its use, and the need for designs that can better isolate causal signals. Despite these caveats, when evidence quality and bias risks are weighed systematically, the pattern of association remains consistent across diverse settings and methods. The paper closes with a pragmatic message for clinicians, families, and policymakers. Avoid indiscriminate use. Discuss dosing and alternatives with healthcare providers, and recognize that a long-accepted default may warrant a more cautious approach in light of accumulating evidence. For researchers, the path forward includes standardizing exposure assessments, including biomarker approaches and timing, improving control for confounding by indication, and refining neurodevelopmental outcome definitions to reduce noise. The authors disclose NE funding and note a potential perceived conflict related to prior expert witness work by the corresponding author, underscoring their aim for transparency. Overall, under a conservative and methodical framework, the review supports advising pregnant patients to limit acetaminophen while preserving its role for necessary